do laser cap actually work to treat your hair loss, or are they just another gimmick? I want to explain the science behind low-level laser therapy and explain a little bit about hair loss and how hair loss happens and what can you expect if you choose to go with low-level laser therapy. If this is your first time on my channel, hi, my name is Zoya. Welcome. I am the hair loss and hair extension specialist here in Dallas, and I do have a salon here, and for the past 25 years I have dedicated everything to find out everything and anything I can about hair loss and how you can treat it, and eventually what can you do to make yourself feel and look beautiful. Let's actually go and kind of break down the different type of hair loss and what is the common type of hair loss. There's a big difference between men and women when it comes to hair loss. Women generally go diffuse. Their hair start getting thinner right around the top of their head, around the crown, sometimes around the side and the back, but generally from the top first. And if you look at this chart, you will see the starting place is very fine part that start getting thinner and thinner so you can see through it, and then that on its own start progressing. The male pattern baldness is a bit different. Generally for men, starts from back of their head and right around the front and start receding. Knowing what stage of hair loss you are, it helps you address the hair loss a little bit more aggressive or just a little bit slow and more steady. But again, 98% of hair loss get to be falling in that category called androgenetic alopecia or a pattern hair loss. And actually laser is something that is especially work really well for pattern hair loss. And there are many studies and there are many researches that has been done on efficacy of lasers and what they can do and how it can help. When you look at a healthy follicle, here you have the bulb of the hair, and this is the root. And at the base of the root, where it goes under the skin, you have your sebaceous glands, you have smallest little muscle and blood vessel that go and force feed your hair shaft or hair bulb. This is, if you look at it as being a healthy hair or healthy hair shaft, this is full, thick, and it's normally shiny, and it is kind of in a way form of complete hair. Testosterone and estrogen, both of these hormones, they create a byproduct called dihydrotestosterone, also known as DHT. Actually, so I would say they're byproducts of the hormone. They're not a hormone on its own. But when DHT gets produced in our body, what it does, it goes and affects our follicle. How that works is DHT goes and start blocking the blood vessel that goes to our hair shaft or hair bulb. By blocking the blood vessels, your hair stops or slows down growing or staying healthy. It's practically like a baby that it doesn't get fed. Eventually it gets skinnier, and it goes to die if it's malnourished. So when the DHT completely blocks the hair follicle, that's when our hair starts completely falling out. We have several growth phases for our hair. Of course, we all go through a natural shedding process. The problem is a lot of women think that shedding is actually what's causing their permanent hair loss, which actually shedding is 100% normal. Our hair is never like, there's a phase that it grows to between 3 to 9 years. That's the growing anagen phase of our hair. But eventually that hair starts shedding and falling out, and then we have new hair growing. So shedding is not the reason, and there is no amount of coloring or brushing or washing your hair that can cause permanent hair loss. You might damage the follicle or actual hair strand that is outside your scalp. But as long as the bulb and the shaft of the hair is healthy, you're going to grow more hair. So that is not the problem. But understanding that, it will help you understand and address your hair loss a little bit differently. Actually being able to cleanse the scalp and make sure on top and on surface, on the soil, you don't have any debris, oil, or all the buildup. It helps if the hair is there, and if the hair is coming back, grow out healthier, shinier, and with more vibrancy. What we want to do, and what practically every hair loss product does, it goes in and it brings more blood to the hair shaft or bulb. When you actually bringing more blood flow to the shaft of the hair, it's like what ophthalmologist does when it starts dilating our eyes. You want to open up the blood vessel that goes in and thin out the DHT. It's a lot harder to try to figure out how to stop your body from making DHT. But what you can do is address the problem, address the byproduct of it by bringing more blood flow to the surface and thin out the DHT that is affecting the hair follicle. And that is what practically laser does. It goes beneath the surface, it dilates your follicle, and it would let your hair get more nutrients, and eventually and hopefully it goes in and it repairs itself and it makes the hair shinier and healthier and stronger.